alterations in immunity and hematology, HIV, AIDS. AIDS is an infectious and potentially fatal disorder that weakens the immune system. It's caused by the pathogen HIV. HIV positive people can infect others even if they are asymptomatic. HIV and AIDS is a pandemic. 34 million are infected per the World Health Organization, and that might be even higher at this point. This occurs most often in homosexual men, IV drug users, heterosexual women, and healthcare workers. Now, when HIV and AIDS first became very prevalent, it had an extremely high mortality rate. It was basically a death sentence. The only question is how long will they survive? But these days, with the advent of a lot of new drugs and treatments, the mortality rate is significantly declining. There are different subtypes of HIV. We have HIV-1, which mutates easily and frequently, and this subtype is more prevalent in the United States. HIV-2 is less transmittable. There is a longer interval between the virus and the AIDS. This is mainly seen in Western Africa. The structural characteristics is it does require a living host to survive. It is basically genetically incomplete, so then it begins to fuse with the T cell lymphocytes. So it basically is attaching itself to the T cells. And then we have those entry inhibitors that we have a development of a new category of antiretroviral drugs. Then we see replication enzymes. We have the reverse transcriptase, which will copy the RNA, the viral RNA, to the viral DNA. Integrase will then incorporate the viral DNA into the host cell of the DNA. So we're basically changing the DNA of the host. And then protease is going to free the replicated viral particles into the cytoplasm of the cell. HIV is transmitted through body fluids, and this includes blood, semen, and vaginal secretions, and breast milk. High-risk factors for the transmission of HIV include unprotected sexual intercourse, multiple sexual partners, sharing of IV needles in drug abuse, non-autologous transfusion, blood transfusions that basically come from a donor, and infected mother to infant transmission. So how do we prevent the transmission? Well, the best way is to abstain from sexual intercourse, avoid casual sex with multiple partners, always use a condom or spermicide, abstain from using IV drugs that contribute to distribution and hypersexuality, and bank autologous blood, in other words, self-donate blood if you anticipate the need for a blood transfusion. As far as nurses, standard precautions are very important, and make sure that we report any needle sticks or injuries from sharps. A client with AIDS indicates that more teaching about the condition is needed when the nurse hears which of the following statements. I'm afraid to touch anyone. I might give them my disease. We know that this is not true. AIDS is considered the end stage of the HIV infection. Criteria: we have to have a markedly decreased T4 cell count. We also see the development of certain cancers and opportunistic infections. It is classified as category 1, 2, or 3, and category A, B, or C. AIDS is going to impair the ability of infected T4 cells to recognize foreign antigens and stimulate that B cell lymphocyte. The rate of progression will be dependent on the concentration of the virus in the blood, the subtype and strain of HIV, and the status of the co-receptors on the CD4 or T4 cells, and how effective the drug treatment is. These clients often mistake this acute retroviral, oh my goodness. They often mistake the acute retroviral syndrome for the flu. So they may not recognize these symptoms as being attributable to HIV. Instead, they think maybe they have the flu. So they may develop a fever, swollen and tender lymph nodes, pharyngitis, rash, muscle and joint pain, liver and spleen enlargement, weight loss, Kaposi sarcoma, which is a type of connective tissue cancer, and pneumocystis pneumonia, abnormal pap tests, or PID. What is going to kill these patients? It's usually going to be pneumonia. Different tests can be done to identify HIV: the ELISA test, the Western blot, and the total T cell count. The viral load P24 antigen test, polymerase chain reaction, is usually done to guide drug therapy and to determine the progression of the disease. Other things that can be done are cancer screenings and Pap cervical tests. A client with AIDS is unable to cough because of weakness and fatigue. This client is at risk for ineffective airway clearance. So how do we treat AIDS? We can do the antiretroviral drug therapy, which will target viral enzymes, or the highly active antiretroviral therapy, also known as HART. Some of these antiretroviral drugs include a nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, and fusion inhibitors. Again, these are going to be very strong medications, so there will be numerous drug reactions and numerous adverse effects, such as nausea, vomiting, diarrhea, pain, suppression of the bone marrow, which means we're at increased risk for anemia, infection, and bleeding, rash, seizures, etc. So there is a problem with potential drug resistance and drug cross-resistance. The goal is to keep CD4 cell count above 350 millimeters cubed, cubed. And we want to keep it undetectable viral load level. Additional drugs that may be given to alongside these antiretroviral therapies would be hydroxyurea and cytokines. There are some AIDS vaccines that are potentially available, maybe just in the clinical trials, but there may be some that are readily available for high-risk clients. Complications with AIDS would include those opportunistic infections, such as pneumocystis pneumonia. This would require the client to maybe be put on mechanical ventilation. They definitely would require aerosol therapy, deep suctioning, and antibiotics. They may develop candidiasis or a yeast infection. They may develop cytomegalovirus, which can cause blindness, ulcers in the esophagus, colitis, pneumonia, and encephalitis. They may develop cryptosporidiosis, uh, which can lead to diarrhea that can cause dehydration and electrolyte imbalance. It's also important to test the feces for ova and parasites. Another complication would be the AIDS dementia complex, where we have a degeneration of the brain. This will affect the mood, cognition, and motor functions. And we may also see distal sensory polyneuropathy, which are going to be abnormal sensations such as burning and numbness. It's very important that we provide teaching. We need to teach HIV prevention strategies such as sexual abstinence and safer sexual practices. Teach diagnostic screening and counseling. Teach about the antiretroviral drug and side effects. Let's hook these clients up with a support group and different resources. We also need to reduce occupational risks, which would include standard precautions, the safe handling of needles and sharp instruments, the appropriate way to transport specimens of body fluids in leak-proof containers. We need to make sure that we clean and disinfect appropriately and use gloves, and remove any barrier garments. Teaching would also include the medication regimen and goals, maintenance of or gaining weight, fluid intake, reporting significant weight loss, avoiding exposure to people that have infections, excuse me, taking a daily bath, frequent rest periods, do not share IV needles or donate blood. A client with AIDS is at risk for imbalanced nutrition related to anorexia, nausea, or mouth sores. Nursing interventions that may help alleviate symptoms that interfere with this intake or nutrient would include all of the following except restriction of fluids. There are ethical issues involved with AIDS. We do have the financial and insurance implications. Some clients are afraid that the disclosure of an HIV status is going to affect their employment, their health insurance coverage, and or their housing. There are viatical settlements that name a person as a beneficiary to life insurance in exchange for immediate cash. This would involve an attorney or licensed insurance broker.